Now, what about bone health? Well, there's no debate in the scientific literature that estrogen is extremely important for bone health. It's responsible for bone growth during puberty, primarily because it increases the activity of these cells in your bone which produce bone. So there's two different kinds of cells in our bones. One kind of cell is called osteoblasts, and those actually produce bone. The other type of cells are called osteoclasts, and those types of cells actually break down bone. Estrogen helps to decrease the activity of the osteoclasts, meaning less bone breakdown, and they increase the activity of osteoblasts, which means more bone formation. Okay? Also, another very important hormone for your bones is called growth hormone. And estrogen increases the production of growth hormone, which will then also increase the bone mass. And finally, estrogen also increases the expression of receptors for vitamin D on the bone. And we all know how important vitamin D is for bone health. In fact, vitamin D is actually a hormone. And so through these and other mechanisms, estrogen is very important for bone health, which is why the majority of women who develop osteoporosis are postmenopausal, because they no longer have estrogen. We're going to talk about the other hormones in a moment, and of course they all have important impacts on bone health as well, but estrogen is probably the most potent. Now, what about estrogen and metabolism? Estrogen is very, very important if you want to have a normal blood sugar and a normal body weight and a normal cholesterol profile, because it does all of these things. It improves your body's sensitivity to insulin. It reduces inflammation, and inflammation is a key ingredient in being overweight and developing metabolic syndrome and diabetes. It decreases glucose production in the liver. It reduces abdominal fat. So yes, if you are estrogen deficient, okay, you're postmenopausal and you're not on any type of estrogen, you are going to gain belly fat. So everybody thinks belly fat's always about cortisol, but lack of estrogen will also cause belly fat. And finally, estrogen also improves the cholesterol profile. When women go into menopause, it increases their risk of developing metabolic syndrome, which is prediabetes, 60%. So that's how important estrogen is in maintaining normal body weight, normal blood sugar, and normal insulin sensitivity. Now, let's talk about what some of the symptoms of estrogen look like. And some of you have experienced one or more of these in the past, but probably one of the most common ones are hot flashes and night sweats. Women also start to notice that their skin starts to age. Their breast starts to droop and flatten. Their skin becomes thinner. They start to develop facial wrinkles. But some of the other things that maybe not as noticeable because you can't necessarily feel them, but things like an increased risk of cardiovascular disease and bone loss, memory dysfunction, which we talked about earlier. So these are some of the things that women can experience when they start to notice declines in their estrogen. And no, you don't necessarily have to be in menopause. There are other things that can create premature estrogen deficiency as well. But I won't get into that now. That's a little bit outside of the scope of this program. And none of you have those issues anyway. So now before I move on to progesterone, I do want to just comment a little bit about breast cancer. Because after the 2002 study done by the World Health Initiative, which was using actually oral Premarin and oral Provera, none of which are bioidentical, the study's results actually showed that there was an increased risk of breast cancer. And so all of the women that were taking hormones were all distressed, and their physicians were all telling them, get off these hormones as quickly as possible. And there's never been a resurgence of the true factual information about that study since then. And that's very unfortunate because that study was flawed, and the information that was gathered from that study clearly was not accurate and could not be applied to women in the context in which they were trying to apply the information. So because of that study, women had been notoriously afraid to take any type of hormone replacement because of their concerns of breast cancer. Well, so here's the deal with that. The number one risk factor for developing breast cancer is actually age. There are other risk factors which include having a first-degree family member, increased or excessive alcohol intake, having never been pregnant before. If you've never had a child before, that increases your risk. If you got your period very, very early, or if you went into menopause later, like past the age of 50, those are risk factors. If you have fibrocystic breasts, that's a risk factor, and also if you've ever had a previous breast biopsy. Those are all potential risk factors for breast cancer. But the reason why age is the #1 risk factor is because no matter how long we live, we are always going to make more estrogen than we make progesterone. And as I'm going to talk to you about in the next slide, progesterone is the body's natural anti-estrogen. And we only make progesterone when we ovulate. 98% of it's made that way. The other 1 to 2% of it is also made in the adrenal glands, but it's never enough to counteract all the estrogen, because remember I told you our bodies make 3 kinds of estrogen, and even after you go into menopause, there's still plenty of it around. So because of that, because we will all be in a relative state of estrogen dominance our whole life, that is one of the reasons why there's an increased risk of breast cancer. The other reason why age is a factor is because the longer we're alive, the more likely we are in menopause to develop high blood pressure, high cholesterol, high blood sugar, and the other factors, and being overweight. And being diabetic can actually increase your risk of breast cancer. And being overweight will increase your risk of breast cancer. So most of the women that develop breast cancer don't have a family history. In fact, 1 out of every 10 women that develops breast cancer has a positive family history, and the majority of women are never taking hormones when they get breast cancer. So the whole notion that hormones cause cancer is sort of silly, because if that were the case, we would all be getting cancer when we're 25. The story is much more complicated than that. And while there is a hereditary predisposition, 98% of it is more environmental in nature and has much more to do with your sleep patterns and your stress levels and your body weight and your diet, your alcohol consumption, whether or not you're a smoker, stress levels, those types of things, because those types of things will impact the way your body produces estrogen and processes it. Now let's get into progesterone, the body's natural anti-estrogen. And as I've already told you, the primary source of progesterone is through ovulation. So for women who don't ovulate, or ovulate but maybe don't make enough progesterone, or those of us that are heading towards menopause, perimenopause, the months we don't have periods, we're not ovulating, there's going to be a state of progesterone deficiency and relative estrogen dominance. Progesterone is produced in very high amounts during pregnancy, and this is one of the reasons why once women give birth, when they have this precipitous drop in progesterone, also cortisol, but they develop postpartum depression. Once you're in menopause, again, since your ovaries don't ovulate anymore, then you lose 98% of your progesterone. So only 2% of it is left, and that is primarily coming from the adrenal glands. Now, what does progesterone do? Well, it's a very, very potent neurosteroid, which means it has very, very potent effects on your brain. In fact, there's research showing how progesterone used in traumatic brain injuries can help regenerate blood vessels in the brain, regenerate brain cells, to help protect any kind of damage to essential structures in the brain. So progesterone is a very, very, very important brain hormone, probably equally or even more important than estrogen is. Progesterone also is a feel-good hormone, and it affects your mood. So it acts as a natural antidepressant and a natural anti-anxiety hormone and a natural sleep aid. It helps to improve immune system function. It is anti-inflammatory. It promotes the use of fat stores for energy. So if you are progesterone deficient, you tend to retain fat, and again, mainly around the midsection. Again, as progesterone is the body's main natural anti-estrogen, it helps to prevent uterine and breast cancer. It improves your heart health in many of the same ways that estrogen does, and it's a natural diuretic. I've already talked to you about the mood, memory, and sleep because of its potent action as a neurosteroid. What else does it do? It improves your sex drive. Estrogen does that as well, but without progesterone, you're going to have a low libido. It also stimulates breathing. And this is really important because women who go into menopause have a 6 times increased chance of developing sleep apnea. And it's not just because they gain weight. It's also because they lose the respiratory drive that progesterone provides because they're no longer making progesterone. Progesterone also stimulates bone growth. It reduces blood clotting. It reduces plaque formation on the inside of the blood vessels. And this is really important. It serves as a precursor hormone to many, many other steroid hormones. So if you were to look at the biochemistry of this, and I purposely didn't put that on here because I don't want to overwhelm everybody, but your hormones are all made from cholesterol. And from cholesterol, it goes to another hormone called pregnenolone. And from pregnenolone, it goes to progesterone. So from progesterone, you also then get aldosterone, which controls your sodium, potassium, blood pressure. You get cortisol, which we're going to talk about in the next module, which does everything. And you get testosterone. So because of the point of location of progesterone on the steroid hormone pathway, it can turn into a lot of other hormones. And this is really important because sometimes you can develop a state of progesterone deficiency, but it's not because you're not ovulating, it's because your body's turning your progesterone into other hormones. This is more often the case in younger women, but it's just an important point to keep in mind. And that's why in some women just using progesterone is not helpful. Because if you're already making ample amounts of progesterone and your body's just turning it into other hormones, then giving yourself more progesterone is just going to put fuel on that fire, and it's not going to make you feel any better. So what happens if you're deficient in progesterone? Okay, well, anybody who you know, self included, that's ever had PMS or premenopausal dysphoric syndrome are deficient in progesterone. And usually it's a relative imbalance because there's either not enough progesterone, too much estrogen, or both. You can experience bloating, difficulty sleeping, weight gain, heart palpitations, fatigue, issues with your mood. I told you it's an anti-inflammatory, so you can have issues with chronic pain. And you can also get symptoms of estrogen dominance, which are heavy periods, painful periods, breast tenderness, irritability, constipation. All of those things can happen if you're deficient in progesterone.